Hello, welcome back to the CashPT Lunch Hour. This is Aaron LeBauer, your host, and today my special guest is Dr. Ed Osburn. Ed is a chiropractor and healthcare entrepreneur. And Ed, I'm excited to have you on the show today. Thank you so much for spending time to join us and share your knowledge.
Hey, I'm excited, man. This is going to be fun.
Yeah, that's awesome. So Ed, just give us a little bit of background about where you are. Like, I know you became a chiropractor. What was your journey from, why'd you become a chiropractor, get into private practice, and then now you've transitioned from private practice to online marketing and coaching? Can you give me that in a few minutes?
I'm going to give you the short funnel version.
Yeah.
So the short funnel marketing vision. So I became a chiropractor because of a girl. I ended up marrying her. No, she was a chiropractor. All her friends were chiropractors. Seemed like a really good idea at the time. And I loved, being, a chiropractor or being in school and having friends that were chiropractors. So it just seemed like a really good fit. From there, my wife and I both as chiropractors, I married her. We came back to Alberta, Canada, and we created one of the largest family care pediatric practices in Alberta. That would have been back in 2004.
Okay.
And 2009, I was diagnosed with severe Crohn's, and our just life imploded. So almost lost our practice, almost lost our house, almost lost my marriage, almost lost my life.
Wow.
And after that, I could just really never get back to the same capacity of being in practice. It was just difficult. So I had to, as an entrepreneur and as a man, provide for my family and figure out how can I do this. And I was listening to a podcast by this guy, John Lee Dumas. And so Entrepreneur on Fire. And I'm like, man, how hard can this be? I can do this. So I started a podcast. I bought his course, So I was a consumer, and then I became a producer. And from there, I created the Chiropractic Philanthropist podcast, which is kind of my version of him, of Entrepreneur on Fire, but for chiropractors. It still is, I believe, the #1 podcast for chiropractors today. From there, doctors started asking me, how do you do podcasting specifically for health professionals? And that was my first online course.
Wow, that's really awesome.
Yeah, crazy story.
Yeah, that's great. That's great. So what's your why? I'm going to get right into this. What's your why? Because we all know you got to have it, because being an entrepreneur and business owner, it's got its ups and downs. So what gets you up every morning to keep push and play?
Okay. So my why used to be to make money. I'll just be straight up. It was like a drug. It was like a dopamine rush. Every time I had money hit my bank account, you get a ding from an online sale. So that was my why in the beginning, but now it's just I see the impact and how powerful it is to help other health professionals, help people outside of their brick and mortar practice. And I also see that now the flip side of it, the freedom that it creates for them. And so that's my deep why now. It's really fulfilling to help someone, gain that sort of freedom and, kind of unchained from their brick and mortar.
Yeah. Yeah. Why is that so important to you?
I don't know. Good question. I mean, no one's really asked me these questions. I don't know. I think it's just, I'm in, Russell Brunson and ClickFunnels, if anyone, Google it, or, I'm in his inner circle, and I'm in this group with people who are they want to make $1 million a year in a funnel, and then they want to make 10 million, and trying to keep up with those people can be exhausting. It's exhilarating and great to be, they're great people, but in the same respect, it's I just feel now like I'm just more coming from a place of, heart, and just want to help people, and I'm not greedy. And so I really enjoy what I do. I love what I do.
Yeah, that's awesome. Did you find when you made that switch internally that it changed your business?
Oh, totally. Yeah. Because I stepped, literally, it was a business decision that we literally closed our practice. We became so much and I say my wife and I, but my business became so much more profitable. If I was spending an hour doing online business or building funnels or whatever I was doing, it was better for me to be doing that for an hour than it was to be in my practice seeing patients. So at one point we literally closed the doors on our practice. We paid off our lease for the next 2 years. We had a bunch of prepays in our office. We were like $30,000, paid them all back. And we still the best decision we ever made. And it was a business decision.
Yeah. That's amazing. That's
Mm-hmm.
awesome. What would you say is the number one thing that you did, I don't know, wrong, or that you do over when making that transition?
Well, the number one thing I did wrong was, like in specifically when it comes to like creating online content or business, and because or just in business in general, was not having any email.
Either one, like when you went from, because I've actually worked with a couple of people who went from, okay, I want to own a practice, to, you know what, really, I need to, create an online business. I need to, impact more people. And so making that transition from being like a brick and mortar clinic owner to being more of an online entrepreneur, healthcare entrepreneur, like switching from patients to empowering and treating and teaching other people how to empower more people, like making that leap, like going from clinic owner to online business, what was the transition? I was going to ask, what's the best thing and people need to know, but I want to start with like, what was the thing that you did and you're like, oh, I'd do that different, or I shouldn't have done that?
I probably would have hired someone who knew what they were doing sooner. Mm-hmm. Like I would have got a mentor specific to like online business. But, I always had mentors when I was in practice too. Yeah. I think mentorship is just, key. So I made I made way too many mistakes, and I spent a lot of money, and even worse, I spent a lot of time just doing stuff that didn't work. I mean, if someone has laid out something step by step where you can actually, to get you to a result that you want, then just do it. Just, I love being sold, and I still buy everyone's courses, and
right.
That would be the number one thing I would change, or I would do over.
Yeah. What do you think that you did, and what would you do that was a home run, a slam dunk?
Ooh, podcast. Mm-hmm. Like it built authority, it gave value, it was free. I interviewed Dan Sullivan, a strategic coach, and I remember asking him, because he's got to be in his 70s now, I think. And if anyone follows him, he's amazing. And I said, dude, why do you do podcasts still? And he's like, they're free. He's like, there's no other better medium to provide value and content to others. And whether it's in whether you're in your practice, like as a brick and mortar practice, and you want to use it as a tool to get more patients or to network in your community, having a podcast and interviewing like someone who, is an authority in your community is like, it opens doors. And so, that was the one thing that I'm like, man, I really hit it there. And that was the best decision. Yeah.
That's awesome. How'd you get that idea? Was it just listening to one of John Lee Dumas's podcasts, or was something else kind of turn you on to that idea?
No, I just started listening to podcasts, and John was selling, that was his one thing that he sold at the time. And I remember too, it was like $1,200, and I was like, oh my God, that's so much money.
I know. He's so good at sales too. Like I've seen some of his webinars. It's like, oh, this is the last time I'm going to offer this. And I mean, it's just like, and he's so like unassuming, or, he's not up in your face, but yet he's there always asking for it. He's great. So that's really awesome. How old is your podcast? Is it
3.5 years.
Okay. And then do you only have one, and is it still going, or do you branch out and do like a different one?
3.
Okay.
3. It's 3 is the podcast is kind of my zone. Mm-hmm. And it's I do a lot of business through podcasting. I've met a lot of really cool people, built a really great network. My Rolodex, if you're not podcasting, you should be. Better than BNI or any of those. Yeah.
Right.
Chamber of Commerce.
What's the easiest way? And I was talking to my wife about this morning, but what's the easiest way for someone to get started in podcasting?
Oh, go to YouTube and Google how to start a podcast.
Yeah.
Like I sell a course that people just basically pay for the convenience of me putting it all to kind of in a package for them. Mm-hmm. But if you went to YouTube, you could just Google it. Google it, you search it. And Pat Flynn has tons of free stuff on there. And it's actually much easier, even like compared to 3.5 years ago when I did it, it's 10 times easier now.
Yeah.
My wife has podcasts too.
Really? Have you heard of Anchor FM?
I have. Yeah. I've had people mention that lately. Russell talks a lot about it lately, Russell
Yeah.
Brunson.
Yeah. Yeah. I mean, I haven't checked it out other than I know it's an app that seems pretty easy to use. And it's just like about getting it out there. I think, I find that the one big difference between people that are in the position that you are is that they're sharing what they know, because there's a lot of people that have the knowledge. There's a lot of knowledge others, but like, it's like what separates people, I think, is who's willing to share it.
Mm-hmm.
Do you have an idea about where or why or how that understanding came to be in you? Like, do you know like where all of a sudden you were like, okay, I can share what I know and still get everything I want rather than having to hold it all for myself?
Yeah, I mean, I just don't really understand that philosophy, because I mean, I've been interviewed many times and I've interviewed a lot of people. But when I'm interviewed, sometimes, I'll be asked, I mean, like, is there anything that you won't talk about? Is there anything you won't share? And I'm like, no, like, ask me anything. Like, whereas like, I know that some people won't share specific tactics or strategies or what's working for them because they want to sell that as a product or service. I've just always had the philosophy of giving.
Yeah.
And, I feel it's almost like energetic. It's like the more you give, it actually comes back to you 10x.
Right. Right.
Yeah, that works for me.
I 100% agree. And, I think but it's interesting. I mean, it's just interesting to think that what drives a lot of people's decisions is the fear that they won't have enough or they won't be able to get enough, whether it's, patients, clients, or money or anything like that. What's your, like, for someone who's struggling with that, what would you say, like, what's the best way to start getting a positive money mindset or abundance mindset or putting yourself out to, give more and to get more back?
For a positive money mindset, I think you just have to change maybe maybe it's people's concept of selling.
Mm-hmm.
Like, I have clients who are doing incredible things, but they have a really, really difficult time asking for money, like selling essentially. And I think that comes back to, again, that money mindset. I mean, you talked about it, like with John, he's a really great salesperson.
Mm-hmm.
He also, look how much content and value he's created in this world. So, if there was one thing I would shift, it would be, like, I would suggest someone who is feeling like they're not being valued or they're not getting the exchange for what they provide, is just ask for more or get more comfortable with selling. I have a saying in our group, it's like, always be offering.
Yeah.
Like, always be offering. Yeah.
Yeah. What, talking about sales, what's the, like, when you were seeing patients doing chiropractic, what were just for instance, what were like, did you guys offer programs, packages? Did you just do like one-off things? Like, can you just give us a brief overview about what you did and like how much were you selling those for at that time?
So I'm always really transparent. You ready for this?
Yeah.
Okay. So we had a family pediatric practice, and so we would see anywhere from maybe 600 to 700 patients a week. Mm-hmm. It was a lot, and I would literally schedule one patient every 2 minutes.
Wow.
And we had like a large open room. We called it an adjustatorium. So some people might kind of judge that. It's like, how we practice, but it was fun. It was a lot of fun. So people would initially, basically, like, as a new patient come in, we would put them through a very specific system of, like, testing. And we had assistants who, did notes and like did their soap. And then I would come in, do a quick consult, do some testing. We would have them come back after, if we sent them out for x-ray or something like that, or a special test, have them come back on a separate day. And we'd basically do a report of findings and give a care program recommendation based on like what I felt was the best approach.
Mm-hmm.
And then, of course, we always did reevaluations and course correction if necessary. But that was, we were basically known as the, family practice in our town of about 80,000. It was fun.
Wow.
Yeah.
What's like, when we're talking about, creating an offer for patients or for clients or for online, like, is there one sales strategy, whether it's a question, a pitch, offer type of, like, tactic that you use that you find like is one of the most effective things for you?
I think for me, like whenever I was doing we called it a report of findings, like here's basically what we found,
Mm-hmm.
right? Here's what I recommend. Was one of the main things was just basically the transition between the question of here's what we found to here's what I recommend. Because
Yeah.
let's face it, I mean, what you recommend is you're kind of selling and marketing to them right there. It's like you have to sell it, because if you don't sell it to them, they're not going to get the care they need and they're not going to get better, right?
Mm-hmm.
So I always made a very clear point from the transition of getting permission from the patient to explain how I could help them. And I do that today.
Yeah.
Like I was on a call with someone who was applying to be part of our high level inner circle. And do I have your permission to explain how I can help you?
Mm-hmm.
And it was like, it would almost deflate, the tension they're feeling, because they just saw everything that's going on with them. And now they're like all stressed. You could see the tension in their body. But when you ask for their permission, they kind of like sit back and they relax. Okay, yeah, show me. Or they would say, well, I have this question, right? So you could, if there was any questions, objections, or confusion, or you weren't clear in your communication, you can take care of that before you move forward to the recommendation. Because sometimes, not all patients, but sometimes what they're thinking about is, how much is this going to cost?
Mm-hmm.
Yeah.
Mm-hmm.
Especially if it's cash-based, right?
Right. Do you find that that's like the primary objection, or what people say is what it's going to cost, or is there something else also that?
I think if you do your job,
Yeah.
like, and do that. And I was always there's some people, like, especially as chiros, there was some people that are very hardcore, it's almost scary for, like, it's, some patients. But I was always very soft about it. And, no, I think if you do your job and you get them to that place, I think pretty much anyone would see the benefit of care. And if it's a reasonable recommendation, then why would they not start?
Right.
Yeah.
Right. And that's awesome. Why do you, like, my perception as a massage therapist, physical therapist, is that chiropractors are better at sales and marketing than we are. I have my ideas about why that is, like as massage therapists are better at business than physical therapists coming out of school. Like, why do you feel like, do you see that? Do you see that, like in business, whether it's chiropractic business or even like online, like, I know there are a bunch of massage therapists. I know PTs online, but there's a lot of chiropractors who have very successful businesses online. I see like that there's this innate thing where there's maybe a little bit more entrepreneurship or sales or marketing or some training as a chiropractor as a profession. Do you see that? And do you have an indication or why that might be?
I think we have to, as chiropractors.
Mm-hmm.
And I don't want to make a gross generalization here of physical therapy or physical therapists, but I do know that, I don't have any clients in what I do for online business that are physical therapists.
Mm-hmm.
Not saying that there aren't any that want to be in the online space. However, there's also, my experience was just, hey, they want to make $60 an hour. They'll get their, they'll clock in, they'll clock out. They have their job, right? It's a job.
Mm-hmm.
With chiros, often it's like you have to be able to market. You have to be able to sell to your patient. We're not like medics, right? We also have, there's a lot of, there's certainly some skepticism of what we do. So yeah, we have to be able to, if you want to have a successful practice, we have to be able to do that. And I think it was more out of survival necessity that chiros are more apt to be good marketers.
Right. So like from me, my perspective now that I was a massage therapist first and I went into PT and I was like, oh my gosh, like you're missing so much of this stuff. But it's PT the profession came out of being physician extenders. And only in the last 30 years have broken away from physicians and having direct access, which means, to see patients without a referral. And we haven't had that. I haven't needed that in North Carolina since I've been a PT, and it's been a law in North Carolina for 30 years. And people still practice that way, that you see the orthopedic surgeon first or primary care first and then PT afterwards. And versus chiropractors who are, not always just kind of off to the side. And like there's like a parallel. And, it's like chiropractors don't always have like hospitalist rights. It's like not like osteopaths have the same kind of privileges as MDs. And you have to do it. Like, otherwise, yes, like you said, the profession wouldn't survive.
Yep.
Massage therapists as well. Like, no one's feeding, insurance doesn't pay for massage. No one's feeding massage therapists through medical providers. And so you have to go out and build a business, et cetera. I see more parallels between massage and chiropractic than PT. And, and I see it. And there's something about people that makes them an entrepreneur. Yeah. In there. Do you see where I'm looking at this from?
Yeah, definitely. I mean, and let's just face it. Like, I mean, if you're doing business, and you're not billing insurance, which was, in Canada, basically we're not billing insurance at all. Mm-hmm. I mean, cash is king.
Yeah.
Like, so we have, like, it's a cash-based business. So, people pay for our services.
That's awesome. I mean, do you know, like what would you say to some, because I know there's people out there, they're like, I think I should go into business, or I've always been wanting to, but everyone's told me it wouldn't work, which is one of the things that I was told. But where do you see like that drive to become an entrepreneur came for you in this context? Where did that come for you? And how, like, what could you say to someone to help them identify where that is in themselves?
I've always just wanted to, I just feel like they're entrepreneurs. So having your own business is a different mindset. So the entrepreneurial mindset is very different than the employee mindset. Yeah. I was just never a very good employee. Like, I still am not. I mean, I still don't work well with others. Like, this is why I'm solo in my business pretty much. Yeah. So if that's the kind of person who's hearing this today, this conversation, well, then you should probably be an entrepreneur. If you're an employee, then you're probably undervaluing what you do, or you're not, meeting your fullest potential if you're not trying to be that, have your own business. So, I mean, again, it comes back to entrepreneurs being people who just want to grow their business versus like employees. Like,
do you think, and I don't want to stay on this too long. I know we have a few minutes to go, but do you think the chiropractic profession attracts more people with that mindset already? Or do you think it's something that they're teaching you or empowering you to express?
Are we, I think what happens is, and maybe this is true with, maybe physical therapy, it's the same thing. Students think they already know everything when they graduate. So they struggle for probably a year or two. And then they realize this isn't working. And then they decide they're going to actually make a change. So they get a mentor, they take a course, they start learning, they start expanding. They realize it's not about no one's going to save them, and they actually need to save themselves. Yeah. Does that answer your question? I mean,
there we go.
It's very common. Yeah.
It's there. And I mean, I'm not trying to discount our profession, because there are some amazing physical therapists who are business entrepreneurs. And, and I think but there's something unique about it for people. And my whole experience as in PT was, don't do that. It's unsafe. It's unproven. No one's going to pay. And I'm like, but that's not how I want to do this business. That's not how I want to treat my patients. I have to go do this other thing. And I know there's other people like that. And I'm always trying to figure out, like, where is that piece in everybody that they knew that was their path. So you answered my question, and thank you for that. What would you say to someone who is a healthcare provider and wants to help more people and start an online business, or, podcast online business, and do something more than just be in practice day to day to help them get a big step ahead?
I would say the first thing is to start listening and following people who are marketers, like John, listening to John. I had the opportunity to interview him too. He was the only person, by the way, who ever intimidated me on my podcast. It's crazy. Yeah, so I followed him. I interviewed Grant Cardone, and I had some really, really cool conversations like Jack Canfield. All of these people are marketers, right?
Mm-hmm.
Um, so I would, I would say start consuming podcasts, start learning and following people who are marketing and selling, because it rubs off on you, and you can't help but become a better marketer, a better, salesperson, even a better doctor, a better physical therapist. Because like, look at you. You want people to follow and be compliant with your care. You have to market to them to get to do it. I mean, it's all marketing and sales, whether it's like money that's exchanging or value. So that's what I would say is start
Yeah.
following marketers.
That's awesome. That's awesome. Anything else you want to add before we wind up about anything we've talked about or anything else you've learned along the way?
I don't think so. I mean, if anyone is listening that would like to maybe jump onto the chiropracticphilanthropist.com, you get a ton of value just from the podcast. It's free. We're not pitching anything on it. And it's, I mean, there's some really good interviews with like Dr. John Gray, who wrote, best-selling author. There's like Grant Cardone. And it's fun too, I think, to see someone like myself who, is a guy who was basically in his basement in Alberta, Edmonton, Canada, in the armpit of Canada, talking to these people from his basement. And it's inspirational that if there's, someone like myself who can do that, it's pretty much anyone can do it.
Yeah. That's awesome, man. That's really awesome. So if someone wants to get in touch with you or find out more about you, we've got the Chiropractor Philanthropist podcast on iTunes. Where else can they find you and find your website?
By the way, I was told that was the worst name for a podcast ever.
It's a little bit of a mouthful, but
no one could say it. So it's the Chiropractic Philanthropist, or I have the Laptop Lifestyle podcast, and that's the website. So laptoplifestylepodcast.com. Again, I had a Grant on that, and on that one specifically, I talk to, or I speak to really hyper successful online entrepreneurs and marketers and salespeople. So those would be the two places that I would send anyone who wants to learn a little bit more, or just go to Google and Google me.
Yeah, that's awesome. Well, Ed, thank you very much for being here. I really appreciate you taking the time out of your day to share your knowledge and experience with us. So thank you so much, guys. Go check out Ed's websites and podcasts. And this is the CashPT Lunch Hour. We'll see you guys next time. Thank you.